bonus systems. Why do we have bonus systems?
Well, this should be interesting because this is very much a double-edged sword topic, because we want our teams to be motivated and we want them to want to do more, and we think that incentivizing them with a bonus system is the key to all of our concerns
Problems.
about, right, exactly. And you know, it's funny because we tend to gloss over bonus systems a little bit because sure, we want to incentivize our team as much, I think, if not more than anybody else, but we worry about letting that go as a bonus systems tend to become a deserved or a entitlement type of thing. And we don't want it to be that. We want it to truly be a bonus system for an overachieving team. You know, somebody that is, you know, teams that are really engaged and they're really, you know, into what's going on and they're really, you know, working on the practice. But a lot of times, you know, you see bonus systems that have gotten out of control in practices, or you see systems where the bonus is, it's deserved, it's entitled, and it doesn't work for what the original intent was. And I think the doctors can be very open about what this is about. You know, this is about, I want you to understand my position in the practice. I love owning a dental practice, but I want you to come along with me on the journey. I want you to come along for the ride. And so what is this about? You know, I want to incentivize you. If you put more effort into it, if you put more passion into it, then what's going to happen in the practice?
Well, I think there's a lot of different ways that you can bonus.
Absolutely.
I think that it's absolutely something where you have to have that team goal atmosphere, BAM, you know, what's your bare minimum that you have to do every month to make, you know, all your overhead.
Absolutely.
And
that has to be definitely a prime consideration.
Yes, and that has to include your salary as well, or your amount that you're paying yourself.
We've seen practices that have bonus systems where the doctor's not getting paid.
Yeah, so
and he's paying bonuses.
The bonuses
or she.
Are not. The BAM is not included with his or her expense. You know, what he's paying himself or she's paying
Figure
themselves.
out what your base salary is and then go from there.
Yeah, and that has to be included in your BAM. And then I think you can do it a variety of different ways. Some people like to do profit sharing. Some people like to do a straight across the board bonus. Some like to do a percentage over BAM. It just really depends on your office and what you see fit and what you're comfortable with. What's worked really well in our office is, you know, making sure that we do set our goals, and we haven't, I mean, our goals are constantly changing because we're constantly, you know, we added a hygienist, so that, you know, added another, you know, provider to our practice.
We added a doctor, you know.
Yeah. So, you know, we've added different things. So your BAM has to keep going up with that, and your goals have to keep going up with that. Otherwise, if you stay at the same goal and you hit it time after time after time, and you pay, you know, a flat fee bonus or whatever you're going to pay, it does become more of an expectation. They expect a bonus every month, the team does, rather than, wow, we did great, you know, we got you know, some extra. And so what we've done is we've set our goals based on our BAM, which our accountant has helped us with. You know, we're not sitting down figuring line by
line. We don't pull it out of thin air.
BAM is, no. And I think the key is making sure that you're evaluating that every month, and making sure your goals are set where they need to be. And then, like I said, in our practice, we do a flat $300 if we hit goal, and then if we're substantially way over goal, we've gone up to, you know, almost $500 some months. But we don't, in our practice, we haven't done a percentage. We've just done a flat, you know, flat rate across the board, and everyone is super happy with that.
Percentage works as long as it's based on certain benchmarks that you want to hit. If you want your team, you know, if you're worried about keeping your team percentage that you're paying out for your salaries and that type of thing at a certain level, make that you know, a benchmark. And then if you want, you know, new patients to be a benchmark, and you want referrals to be a benchmark, you know, whatever you're really focusing on in your practice, make those benchmarks. And I've seen it work very well in offices that, you know, each of those is tied to 20% of the bonus or a quarter of the bonus, and have, so each of those benchmarks that they hit, then they get that percentage of the bonus.
Yeah, and we're all very team oriented. We don't have, like our hygienists, they have daily you know, goals and, you know, a monthly goal for a hygiene department, but they don't get an extra bonus for hitting those. These are their goals so that we can hit BAM, so that they can be part of, you know, our team bonus. And I mean, so we don't divide it out department wise either. Some offices do that. but we're all team, and that keeps us very team focused, which in turn makes us have a really team atmosphere in our practice. One of the things that we also have from being a larger practice that we've gotten a lot of questions on is, well, how do you pay your team leaders, or how do you bonus them, and actually pay them for being a leader.
Sure.
Some people like to pay more hourly to them if you're paying hourly.
Sure.
But what we found to work is paying them a percentage. So for example, our hygiene team leader,
which our hygiene department has grown exponentially. I mean, our hygiene has just exploded.
So we pay a percentage to her of whatever hygiene collections are, and normally that ranges from 1%, to the most I've ever heard anyone say is 2%. So 1% of or 1.5% or whatever you feel comfortable with, but really. Patting those team leaders on the back and saying thank you by giving them a little bit extra to say, okay, thanks for taking care of the day-to-day things.
Well, and for example, I mean, we have months that our hygiene department does, $80,000 a month. And so 1% of $80,000 is $800, and that's a nice bonus for our hygiene team leader. And she truly appreciates it, and she deserves it. She's really cranking up that hygiene department and making sure that everybody's accountable and doing what they're supposed to be doing, which is priceless.
So making sure you have, an accountability system with your bonus system, and also making sure that your bonuses aren't set so low that they're achieved all the time. That you actually have to work, to get there, and then also making sure that they're not set so sky high that they're not achievable. Because,
or that they're running the doctor ragged to be able to achieve it.
Yeah, that'll really, bring down some mindset in your practice, but making sure that you have something. And some people, some offices, they don't have a bonus, system. Their bonus systems are, once a month they go out to dinner, or they all go to the spa, or they have their nails done, or things like that. Sometimes it's not an actual monetary thing. It's actually services that they're all doing as a team. And sometimes it's working towards going on a CE trip that's out of state, or something like that. So there's a wide variety of different ways you can do it, but I think there needs to be some type of incentive system for each practice.
Right.